All right, this one is herbs and testosterone in men. What are the top herbs for male enhancement and raising testosterone, lowering estrogen in men? You know, if I was to stop there and say, you know what, if the truth be known, make tissue healthy. That's all you got to do is make cells healthy. Well, that means you have to have a healthy kitchen and you have to have a healthy sewer system. That's exactly what that means. And then the pathway finds its own. Now that's a simplistic approach. When you want to know what herbs are good for that, I like Damiana. I mean, Damiana is definitely one that's not overly aggressive, because here's the problem. Remember, if you have prostatitis or you have prostate cancer, anything like that, where you suspect any of that, you do not want to use male enhancement herbs, and you're going to have male enhancement problems when you have inflammation or acidosis building up in the prostate and testicles. You're going to have this problem, and of course with that always is what weakness? The adrenal glands, where the final testosterone takes place, right? So making these tissues healthy is key always to the balancing of steroids or hormones or neurotransmitters, as far as that's concerned, right? But I've used yohimbe before. These are hot. When you start getting into some of these herbs for the prostate and for males, they're hot. And that's the issue. When you're already highly acidic, you're hot. You can feel cold, but be hot. You know what I'm saying? Some of you get that. And that's those with the low thyroids. It's burning inside from acidosis. You're cold, but you're hot. There are doctors who advocate taking testosterone injections because they claim that low testosterone increases one's risk of heart disease. No. You know what? This is the problem with that sort of thinking. It isn't low testosterone that causes heart disease. And heart disease is a stupid name. I mean, you got blood occlusions, which is generally a lipid occlusion or a calcium occlusion. That all comes from acids. It all comes from the lymph system. You have congestive heart failure. It's not a disease. It's a lymph system backed up in the heart. You have the calcium loss, so then you have mitral valve or tricuspid valve loss, so you have regurgitation. You have electrical system in the heart that the adrenals control, so that can go off, and you can have all kinds of symptoms, from AFib all the way to throwing PVCs, heart blocks, blah, 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 blah. The relationship is not with testosterone. The relationship is with the kidneys and the lymph system, and I might add the adrenals. So the connection to heart disease and testosterone isn't through the testosterone pathway, it's through the adrenal, kidney, and lymph pathway that low testosterone means. But they're fixated on this and not looking at causative factors. Where does testosterone come from? What's the role of the adrenals and kidneys? But they don't even know that yet. I mean, if you want to increase testosterone, what do you have to make healthy? Your prostate and especially the adrenal glands. And of course, having good testes is good. And what breaks all that down? Acids, lymph, that whole thing. So if you want good testosterone, have good adrenals. If you want good thyroid, have good thyroid. But how do you make things healthy? Again, understanding what breaks them down. I am 51, that's pretty good, but have had to take testosterone replacement. Oh shit, for 7 to 8 years. Now you see the commercials talking about what testosterone's doing now. Yeah, you already had adrenals, so you had low adrenals, so now you're popping. So you want to get away from that, of course, and start getting on your adrenals. That's where you definitely want to use a glandular 400 milligrams, I think, every hour. Not every hour, but 3 times a day. Use the adrenal glandular 400 milligrams, 3 times a day. I would also go after my kidneys, clean the prostate, testicles, things like this, so you can produce better testosterone, because you're going to have a bump, because you got to give off testosterone. And if your PSAs, I hope you're checking your PSAs, because if you're having inflammation in the prostate and you pump this much testosterone, you push yourself deeper toward the prostate cancer issue. So you want to get away from this serious stuff. You might have a low here for a while, but better to have a little low and fix everything everything right and come out on top than it is to start losing some serious stuff here. But my worry is being so long on testosterone. Not smart. That was not good. And of course, medical doctors here, belly right up here, will give you testosterone. It's almost like there's a willingness to destroy tissue in people. It's almost like it's a willingness to do it. It's like, what? Jesus. You know, or it's just a machine that can't think outside of a box. But there's plenty of attorneys out there now. Testosterone, bad drug, although it's a steroid, but bad drug. I'm 48 years old. About 2 years ago, I started to lose my libido. Almost never wake up in the morning with something. I've noticed hair loss on my hands and legs. Yeah, I mean, this is acid. You want to get that out of there for the prostate and the testicles, get that out of there, get that adrenal up. You're seeing that adrenal hit there with the chronic fatigue, low testosterone, blah, 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 blah. It doesn't matter what your blood work shows up for testosterone, let me tell you. More symptomatic is right here. And that's very suggestive that you're running low testosterone, you run low adrenals anyway. That would just make sense. And probably in your favor right now, though, because running low testosterone definitely keeps the burner down. In other words, lymph is what burns cells bad, no question about it. But you throw a little testosterone, a little estrogen, now you're throwing gasoline on the fire, no question it exacerbates the problem. Well, the hair loss might not be low testosterone. The hair loss just might be the subcutaneous tissues of your skin is backed up. You could use the prostate formula for a while first. Check your PSAs, make sure they're down. I highly recommend it's like a $40, $50 check maybe. Go into a lab, negotiate. Most people can walk right into a lab and order up. You want to look at your prostate and see what it is. And if it's above 1, do not use any male reproductive stuff because elevating your testosterone levels on a PSA of 1 or above would not be smart, especially the younger you are. We've seen PSAs of 2 prostate cancer in 40-year-olds. So we just want to get that down, you know, get those kidneys filtered, get that lymph moving. Then we can hit that puppy and you're good. My girlfriend is wondering if you could address her opinion regarding unbalanced hormones for females. She has been on the pill for 6 years but stopped 4 years ago. She has been working over 3 years with a naturopath using herbal tonics. She is really healthy, no questions. However, still got some testosterone level at a bit high and estrogen a bit low. What could you suggest? Well, if your estrogen is low, take some black cohosh. I think that's going to be the best remedy for that. You can take the female reproductive formula to strengthen up the female tissues like the uterus and the ovaries, but it is a progesterone formula. If you're running low in estrogen, which will give you more vaginal dryness and stuff like that, then that's the adrenal glands. You can take black cohosh to inspire that, but you might specifically want to work on your pituitary 1 and your adrenal number 2, because those are the 2 places you're going to see the most effective toward testosterone and estrogen levels, but your adrenal is the most important. And now look at testosterone. Right now it's considered, of course not a drug, but considered a bad drug. And so now they have lawyers all set up because people are having heart attacks from it, you know, all the guys and all these things, and it's like, that wasn't worth it. So you fix things. You let your body be the knower and the doer. You just make your body healthy and keep away from these things because it depends your goal in life and what you want to achieve. Some of you want to achieve God consciousness. Others just want to have a good life physically. Others are athletes. Others have all levels of things. And this applies across the board.